Hello, my name is Andrew Buskey. I'm a physical therapist at Milford Regional Rehab and Sports Medicine in Northbridge, Mass. I'm here today to talk to you about TMJ pain and dysfunction. Not many people know that temporomandibular joint dysfunction or TMJ can be addressed with physical therapy. For a lot of people, they may have had traditional physical therapy for their headache or neck pain, but not had their TMJ joint addressed. So our TMJ program involves a multiple disciplinary approach to provide the best care we can for you. The physical therapist is often working with your dentist, potentially your primary care physician, potentially even an orthodontist. What we're trying to really do is create an individual program based on what your needs are. During our first visit, we try and focus on when are you getting the most pain? What seems to be aggravating your symptoms? What seems to be making your symptoms feel better? Based on what we find out through that initial interview evaluation is an individualized program for your specific needs. So during your individual program, we'll probably touch upon when you feel the most amount of stress during your day. Typically with higher amounts of stress, you typically have more TMJ pain. When it comes to that stress, it's very individualized based on somebody. Are you dealing with stressful things in the household? Is it maybe you had a past motor vehicle accident and you're stressed while driving? A lot of times during those stressful events, we're grinding our teeth. We're pinching, we're tensioning everything up. And people may not be realizing that because we're not consciously aware of it. When we're not consciously aware of it, those muscles are constantly activating, compressing our TMJ joint and creating pain. So our main goal with this program is to empower the patient. I want you to feel like you have control over your symptoms, to know what may be contributing to them, but also some strategies to make those symptoms feel better. Realistically, with TMJ joint, you may always feel some clicking and popping in the joint, but if we can alleviate some of that pain, maybe it makes you go through the day just plain happier, feeling like you have control over your symptoms, that's a huge accomplishment in itself. If you feel like your TMJ dysfunction is really impacting your quality of life, feel free to come down, we'll work on it together. We'll at least explain why you're having symptoms and develop strategies individualized to you to make things feel better.